Everyone at one time or another is going to experience anxiety. For example, when you're preparing for an form of speech, but you also have midterms to study for. The feeling you're feeling is anxiety. Anxiety is the worrying or nervousness of uncertain outcomes. Then there's anxiety that is chronic and affects your day-to-day life. This type of anxiety is a mental disorder. It's referred to as generalized anxiety disorder. At one point or another, you're going to encounter a person who has anxiety disorder, and the reason for this is it happens to be the most common mental disorder in the United States. The National Alliance on Mental Illness states on their website, NAMI.org, that 1 in 5 adults experience mental disorders. Of the 43.8 million adults experiencing mental disorders, 18.1% of them are experiencing anxiety disorders. This is almost double the amount of adults experiencing depression, which is 6.9%. Today I'm going to inform you of the mental effects, physical effects, and toll anxiety takes on everyday life. First, I'm going to talk about the mental effects of anxiety disorder. One effect of anxiety disorder is to be more prone to alcohol abuse problems. The reason for this correlation is to self-medicate for relief from the persistent worrying. Referring back to my graph, 10.2 million adults have co-occurring mental disorders and addiction disorders. According to ncbi.gov, last updated in March 2017, in a study of 39 patients meeting criteria for alcohol use disorder, nearly half, 46% of them, also had generalized anxiety disorder. The onset of generalized anxiety disorder occurred prior to them having the alcohol use disorder, and this happened in 67% of the cases. Next, I'm going to talk about the physical effects of generalized anxiety disorder. When you think of someone with a mental disorder, you're thinking of the mental aspect, which makes sense since it's called a mental disorder. However, just like it affects your thinking, it also affects your body. There's a lot of physical symptoms a person can experience, and most of these you wouldn't think correlate with their anxiety. For example, headaches, dizziness, dry eyes, hair loss. But today I'm going to focus on the skin. It's common knowledge to know that stress can cause acne or pimples, but did you know stress can cause a skin condition called seborrheic dermatitis? Seborrheic dermatitis is chronic dandruff of the scalp, but it also can affect a person's face, and it can happen in these patches of red, scaly, greasy skin. It can greatly affect the person's confidence. According to ncbi.gov, last updated in November 2007, in a study of 86 patients, the majority of them identified stress as their triggering factor to their seborrheic dermatitis. Stress was associated with higher levels on the state trait anxiety inventory. The psychological effects of this disease were pronounced in 11% of the patients, moderate in 20%, and mild in 35%, and 9% with no opinion. The study confirms that seborrheic dermatitis is often preceded by a stressful event, and anxiety is an aggravating factor. Last, I'm going to talk about the toll generalized anxiety disorder takes on everyday life. Our family, friends, and significant others all play an important role in our life. And the reason for that is because what is life without the people in it? For that reason, I'm going to talk about the quality of life a person with anxiety disorder has with their family, friends, and significant others. According to Jacob Priest's article, Anxiety Disorders and the Quality of Relationships with Friends, Relatives, and Romantic Partners, a study of 9,912 people, with 52.2% of them being females, people with anxiety disorder have higher rates of divorce and are more likely to be single. The study also found that wives with anxiety disorder believe their husbands played a role in aggravating it. Their anxiety, for instance, if their husband had had a bad day at work, their anxiety that day would be increased. There's less studies on the relationship quality between people with anxiety disorder with their friends and their family, but from what little data we do have, it was found that there is no association between the quality of the relationship of friends and family, unlike that of with the significant other. In conclusion, I discussed the mental effects, physical effects, and toll generalized anxiety takes on everyday life. With anxiety disorders being the most common mental illness in the United States, it's important to be informed about them. It is also important to know that if a person is suffering from generalized anxiety disorder, they can still live a full and rich life. This day and age, we're lucky to have modern medication and multiple options of medication to use as treatment. We also have high successes in cognitive therapy. Thank you.